Hello, class of 2022. I'm going to take a few minutes and go over the things that we went over in the lab number 5 so that we can catch up group C and D with what happened in lab. Lab number 5 is the emulsion, the capsule, and the prefabricated product. If you look at page 82 on your lab manual, we're going to make the prescription label just like it is in the lab manual. Take 3 teaspoonsful by mouth as needed. We're going to dispense 30 milliliters or 1 ounce. And when we put the compound in for the emulsion, we made the emulsion and you used added the compound ingredients from the master formulation, which is on page 84. And we just divided the master formulation for 1,000 milliliters to make it 30 milliliters, and we added mineral oil and gum acacia and syrup and alcohol and water, and we just made a compound and made one label for the emulsion. And then we did not make a label for the compounded product of the acetaminophen capsules with the diphenhydramine and the lactose. We just fill out that part of your lab manual is what we did. We printed a label on the for the emulsion, and there wasn't room in the lab manual to put the sticker, so we put it on page 82, just to the right of the label that's on page 82. We used a little white sticker on the right hand side for the emulsion label, and we did not do a label on the capsule, but we went over the methods of preparing the capsules and just doing your best 8 capsules. So if you watch the video and read what's in your lab manual, you should be fine on that. Also, we went over the prefabricated prescription, which is the prescription for PenVK. So we'll talk about that for a second. If you look at this prescription, there's some problems there. It's written PenVK 250 milligrams, number 28, 2-tab POQID, take with 8 ounces of orange juice, give with probenecid, and it's got 2 refills on it. So there's a lot of things wrong with this prescription. This was a prescription that was given by the doctor. First off, he was must have been thinking about PenVK 500 milligram because he wrote it for the 250s and he wrote for number 28, which typically it's given 4 times a day for a 500 milligram dose, and that would have been enough for a 7-day supply. But the first thing we have to do is change the quantity. In this prescription, the prescriber's given 250 milligram tablets because they're smaller, and the 500 milligram tablets are large and hard for the patient to swallow. So what we were doing there was giving PenVK a 500 milligram dose 4 times a day for 7 days. So we need to first off change the quantity of the prescription from number 28 to number 56 because we're given 2 tablets POQID, and then it says take with 8 ounces of orange juice, and is that a good idea? No, that's not a good idea. The 8 ounces of orange juice interferes with the absorption of the drug, so we're actually going to put on the label to not take it with orange juice. There's lots of problems with acidic juices and medications. You might be familiar with some of the drug interactions with grapefruit juice as well. But in this case, we're going to put on the label, do not take with orange juice. Also, there's 2 refills indicated on this prescription. There shouldn't be any refills on an antibiotic prescription. Also, we're also giving with probenecid. So the question was posed, what is probenecid? Do you know what probenecid is? Well, probenecid is a drug we use for gout. It is a uricosuric agent, meaning that it increases the amount of uric acid excreted into the urine. And when it increases the amount of uric acid being excreted into the urine, it blocks penicillin from being excreted. And so it enhances the effect of the drug by stopping its excretion in the kidney, and it keeps the blood levels of the penicillin higher for a longer period of time. Eventually, the penicillin is excreted, but it's excreted at a much lower rate when you take it with the probenecid. So we're using an old drug interaction as a trick to elevate the levels, the blood levels of the penicillin, which is particularly good for certain types of infections like in syphilis or gonorrhea. There are a lot of diseases that require high sustained blood levels of the penicillin to kill the bacteria. So that's what this prescription is being designed for. So to go over this again, the way we're going to write the directions for this penicillin VK prescription with enhanced labeling, we're going to say Pen VK 250 milligram tablets, number 56, with no refills. We're going to say take 2 tablets by mouth every 6 hours for 7 days for infection. Do not take with orange juice. Take with probenecid tablet every 12 hours. That's a lot of information you got to get on the label, and you got to make it so, as always, that the label fits on one label. So you might have to do a little abbreviating, but that's the way that label should read if you get back to lab and print it. So that's pretty much what we did with the prescription. We also then did a case of a case study on a gentleman that walks into your pharmacy and says, "Man, I've got bad leg cramps." And his legs are cramping, and we said, "What questions should you ask this patient about the leg cramps?" Well, we ask, first off, have you been drinking plenty of fluids? Hydrating. Remember, we teach hydrate, hydrate, hydrate. So we ask if you were taking any medications. We're asking if you've been exercising, and maybe that you've got a cramp because you've overdone it out there, or either running a marathon or chopping wood as a weekend warrior at the house, or have you done anything to give yourself muscular leg cramps? And so we turned to the issue of what can we give this patient for these leg cramps. And as you have been learning about muscle contractility, that there's 4 metal ions that are involved in muscle contractility that could cause cramps and muscle cramps, and a deficiency of those things could cause the problem this patient is presenting to you. And that would be potassium, magnesium, and calcium, and sodium. So you could give magnesium supplements will sometimes help leg cramps. Potassium supplements will sometimes help leg cramps. Foods rich in those things sometimes help enough. But generally, sometimes leg cramps are hard to treat, and they don't respond well to just supplements. There's a product that's called Hyland's leg cramps, and it is a form of quinine. We used to have quinine sulfate on the market, and it was a product that helps with leg cramps a lot, quinine sulfate. Well, it's no longer on the market anymore. We used to be able to give it over the counter. And so what we do now is that we usually recommend the product that you might see here on the screen. And it's a homeopathic product called Hyland's Leg Cramp Tablets. And it's it's got cinchona bark in it, which is a tree from South America that is high in quinine. Quinine was given originally as a malaria cure. And it was taken off the market because it's closely related to quinidine. Quinine is related to quinidine, and it has quinidine is a class 4 antiarrhythmic. So quinine in large doses can have an effect on your heart. So before you recommend this to a patient, you want to ask open-ended questions, of course, to triage the patient, to know your patient. And one of the things you need to know is, do you have any heart problems, would be a good question before you'd recommend this. There's a lot of things that quinine is also in tonic water. So if you would use Schweppes tonic water and give 8 ounces of tonic water, it has a lot of quinine in it. So if you want to treat leg cramps in a patient, we would try to get a little quinine, either with tonic water or Hyland's leg cramp pills, or you try just hydration or magnesium supplements or potassium supplements. So the case study in this week's lab was on leg cramps, and if you want to read further and Google leg cramps and their treatment, that would be interesting. And so that's pretty much all we did for lab number 5, and we hope that you're enjoying you've enjoyed your spring break this week, and we'll see what happens as we venture into online pharmacy school because of the coronavirus. So I'm signing off for now, and we'll be back soon. Take care. Bye-bye.